Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board-certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. On today's episode of the Essence of Health Tea Time Podcast, I have a special guest, Dr. Anisa Shomo. Dr. Shomo is a board-certified family medicine physician and geriatric specialist who practices medicine in Cincinnati, Ohio. She serves as the president of the Cincinnati Medical Association. She is a member of various health advocacy groups in Cincinnati. Dr. Shomo is a graduate of Shaw High School in East Cleveland. She earned her Bachelor of Arts in Spanish and Doctorate of Medicine degrees from The Ohio State University. She completed her family medicine residency and geriatrics fellowship training at the University of Cincinnati in the Christ Hospital, along with yours truly, and she owns two health and wellness businesses, Dr. Shomo Knows LLC and Health is Love LLC. Welcome, Dr. Shomo, to the podcast. Thank you so much for joining me.
Thank you so much for having me. I got my tea. I didn't know if that was required, but I love tea. So
hey, it's tea time. So go for it.
I know. Don't threaten me.
I have my warm drink too, but now I just got my big oversized cup of water today. So all right. So we'll start. I'm going to have you just share your story with us because you have quite a wonderful story and I want my audience to hear it. So I know you are a cervical cancer survivor. So just tell us, how are you diagnosed with cervical cancer and what was your treatment like and anything you just care to share about your story?
Yeah. So, as family doctors, one of the biggest things that we talk to people about is going to the doctor even when you feel well. So I actually went for a routine pap smear, and I don't know if my doctor didn't saw something that looked a little bit different and she didn't necessarily tell me, but my pap was the way that the pap guidelines are now. They do two different tests. So one test was fine, the cytology, the pap smear was fine, but I tested positive for HPV, which is very common. So the protocol now is to go to see GYN and have a microscope, look at your cervix, called a colposcopy. So when I went and got my colposcopy, the OBGYN said, well, I see that area of concern, which, like I said, my doctor never really told me that was an area of concern. So, they did a biopsy. And then the craziest part of my story is that I was actually diagnosed with a rare form of cervical cancer called adenocarcinoma. So it's two different glands in the cervix. There's one that's kind of more borderline the uterine glands, and there's one that's more the outside cervix called squamous cell. So most cervical cancers are squamous cell, like 90% of them are squamous cell, but I was in that 10% of people with the adenocarcinoma, which carries worse prognosis. So my OBGYN doctor personally called me to say, I'm so sorry, we were diagnosed with adenocarcinoma and we need to move fast. So she called me personally. She said the pathologist had called her personally. And so I was able to get in to see they sent me to another gynecology specialist called gynecology oncology. So somebody who specializes in oncology of the, GYN system. So I was able to get in with the GYN oncology surgeon in I think about 2 weeks. And so I was able to get my surgery scheduled pretty quickly. I think maybe the next week after seeing him. So I think the biggest thing for me, when we talk about as family doctors, we learn, we dabble in a little bit of psychiatry, so we know a few things. And so for me, the biggest thing was, that's kind of just like what happened, right? But I didn't really talk about my different emotions in that time. So when she called me, I was actually at work. And so I remember being like, oh, that's not good. And just trying to get through the day and trying to finish my work. And then we're very good as doctors, we're very good at compartmentalizing things because that's kind of like a survival skill that we have to have. So I kind of tucked it away for a moment. And then when I came back to it, I went into what we call intellectualization. So that's a coping skill or defense mechanism of just being like, okay, what's the worst case scenario? So I looked up and learned more about, what does adenocarcinoma of the cervix mean? Because as a family doctor, I don't see that a whole lot, even the OBGYN doesn't see it a whole lot because she personally called me because it's something that's not very common. So I, wanted to see like, what am I up against? So that is something that helped me as a person who likes to just know like, what's the worst case scenario and give it to me straight kind of person. So I saw that the prognosis was kind of about 50-50 for adenocarcinoma, which is much worse than squamous cell. And the 5-year survival rate is 50%. Which is better than some. It wasn't the worst news. It wasn't the best news. But what I learned from that was that I understood why she was like, you need to get in with the gynecology oncology as soon as possible. So I understood what I was up against. And I knew that for me, it was going to be important to partner with my doctors and try to do what I could do to be part of that 50% that is, at the 5-year survival rate. And actually, this is my 5-year survival year.
All right. It's a celebration.
Yes.
Yeah. Awesome. And, one of the things that you touched on that, I feel a lot of people probably don't understand about their doctors and about medicine, like you said, is that compartmentalization, especially as family doctors. We can go in one room where we've just talked to somebody about death or dying and go into the next room and see a baby, and this can all happen within the same hour. And you really do have to have that mindset and, that skill to be able to turn it on and turn it off, going from room to room, as well as whatever may be going on with you personally. I can't even just, imagine getting that phone call to say, hey, this isn't good. And then you've got to go on with your workday because there are patients that are depending on you. And so I can, understand that and relate to that, but I just really hope the audience just lets that sink in for a moment, all that your doctor may go through.
Mm-hmm. Yeah. And I think that's what's been the hardest challenge for me is balancing. As physicians, we're just kind of like, right now, I would say the culture, it's not even physicians. The culture in America is you sacrifice yourself and put everybody above yourself, right? Your job, your family, your spouse, all that sort of thing. It's just kind of a very sacrificial culture. And we tend to put ourselves last. I would say, the younger people are better at it.
Yeah, they are. Yeah, they are prioritizing that self-care.
Right. Yeah. But most people from our generation and those older just really have a hard time. So one of the things that was, I can't remember if I still was seeing patients at the time. Like, I don't remember if I had to go back in. I may have just been doing paperwork. So I don't remember if I had to go back in and see patients. I do remember going home and telling my husband, who was taking a nap, about it, and I was just very calm about it. Like, well, apparently I have cancer and, I got a 50-50 chance of survival and, I'm going to go meet with the surgeons and it should be fine. I may have to get a hysterectomy because that's the biggest thing. So there's two big things. Number one is being a physician and trying to balance taking care of myself and taking care of my patients, all that sort of thing, your responsibility. So that's been, tough to navigate. And then the other piece is we don't have children. So it was just kind of like, the worst case scenario is you won't be able to have children. And I have been so like, the craziest thing about this whole cancer diagnosis is like, my husband has just been the best. Like we met when we were 18 years old and you don't know how your spouse is going to respond to all this kind of thing. Right. Number one, I have cancer. Number two, I might need a hysterectomy. Probably going to need a hysterectomy, sooner. We don't know when. I don't know if now or later, but probably going to need a hysterectomy to be a part of that 50%, that survives to 5 years. And so we may or may not be able to have kids. And I just has been like, it's been like, so like, I don't know, renew your faith in humanity kind of thing. Just having a spouse be able to drive me to the hospital, make soup for me. We talked, because you were on my podcast last week and we talked about, having spouses who are self-sufficient. So that is one of the things that has been really helpful in, this kind of thing, is having a self-sufficient spouse who could actually caregive to me when I was down. And then we were talking about different options, like should we, we went to fertility specialists and all this sort of things, trying to figure out just what all our options are. Mm-hmm. And we talked about whether or not we want to do surrogacy or whether or not we wanted, there were just all types of options. And then we talked about adoption and all these sorts of things. And my husband was just like, I'm just really content with just the two of us living our lives like we are, and whether we have kids or not, whatever you decide is fine. But
Yeah. Yeah.
Don't feel pressured by me to have children. Like, that's not where I got married. Like, and I remember when we were young, he would always say that. He would always say, I don't really know if I want to have kids. If I do have kids, probably later in life around 40, because I feel like you should just kind of live your life. And, that was his philosophy even young. And I just remember, it's funny how we've been together
Right. How
20.
things just go, full
Yeah.
circle.
So
Yeah. Yeah.
I have like a big family. So in my family, everybody has kids. Well, for the most part, everybody has kids. So I was just like, I don't know who you about to be having kids with at 40. Like,
Yeah.
we're, I want to have kids young and all this sort of thing. But when we got married when we were 29. And so I got diagnosed when I was 33. And so we had, a few years in between there where we could have had children. But around 30, I just was tired. I was just like, 30 is not the same as 20. You're just tired. We're both we're both doctoring. And I was like, who
Right.
about to raise these kids? Like, who about to raise them? So,
I'm 40 and I still ask that question sometimes about who's raising these kids of ours.
right. It's just
Oh,
the life of a physician, like I said, because we have such a responsibility for our patients. It's just
right.
it's just a different, it's just different. And there's not a lot of generations of lessons that we've learned and things that we can try and all that sort of stuff. So we're figuring out a lot of it out on our own. But we're not 40 yet, so it's possible we could still adopt kids and that sort of thing. But I just appreciated that, my husband, even though we met at 18, was one of the best decisions I ever made at a young age.
Yeah.
And I'm actually going to marry him again in a few months.
Oh, that's sweet. That's sweet. I love that. And I love that you shared that with us.
Yes.
Okay. Yeah, because it is. I mean, support is everything when you're going through, especially something like this with cancer. Support is so important. And so that's special too, that you're able to have that. Because even though you're married, you don't always know how that
Yeah.
spouse is going to handle that. Just because, you've said I do, that doesn't always mean that you're going to have a supportive partner. So yeah, that's wonderful. If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. Now, prior to your diagnosis, now that you've been diagnosed and you've gone through this, what are some things that you wish you had known prior to your cervical cancer diagnosis?
I guess the biggest things I wish, what I would want people to know, I guess, because as a physician and a family doctor, we kind of do a lot of this already.
Mm-hmm.
So what I like for people to know are, number one, that HPV is a cause of cervical cancer, which, like I said, was the reason why I was sent to the specialist, because I was positive for that. And it's very common. A lot of people will be like, is it an STD? What is it? But it's just like a lot of like chickenpox virus, like how everybody gets chickenpox virus, and it's in most people's system. It's a similar virus, but it's just very common. And instead of causing chickenpox, it just so happens to cause cancer. And so I don't know if part of the reason why I've been doing okay with it, because I've had an initial surgery, and I had to be monitored pretty aggressively. Like, I was having to get pap smears like every 3 months.
Mm-hmm.
And they gave me the option. They were like, you can have a hysterectomy now and save yourself like all these years of pap smears and, just a lot of monitoring. You can do that now, or you can just kind of give it some more time. And I opted for the second part, to give it more time to just really come to terms with that. That's a very
Mm-hmm.
final thing, to have a hysterectomy. So I went on a journey and just learned, more about what it is like to go through the surveillance process and all of that sort of thing. And so I never had a recurrence after my initial cone biopsy. But I actually was vaccinated against HPV as soon as it came out. So it came out when I was in my last year of medical school, and when like around 2005.
Yeah.
And I had some issues with HPV like around like 18 or 19 when I was in college. So when they were like, "Oh, we got this HPV vaccine," I was like, "Oh, I want that."
Yeah.
And I actually had to pay. It was like at that time it wasn't covered by insurance completely. It was like
Right.
$150, and I had to pay like $75, and it's 3 doses, and I paid $75. I was like, I want that. So I assume that it's possible that it helped it not be as invasive. It
Right.
helped it help me not have recurrence because I actually was vaccinated. So I think the biggest thing that a lot of people don't know, that a lot of people have heard about the HPV vaccine, but they don't really know, like, I don't have a uterus because of HPV, so
Right. Yeah. Yeah. And that's a real point, because part of us as family doctors, we see children too.
yeah,
And a lot of times having that discussion with parents as to why it's important to get their child the HPV vaccine. And a lot of times parents don't understand that getting this vaccine now could possibly help them 20 years down the road. You do have to be able to have that foresight to vaccinate and to get that HPV vaccine. And the other part of what we know is that it doesn't work quite as well as if you were to get it beforehand, earlier in
right.
life, before you were exposed to HPV, versus getting it after you were exposed. And that can play a major part and make a difference too.
Yeah. So that's that's like I said, that's what I knew, but that's what I wish more people knew is
Yeah.
and because there's all types of other cancers it can cause as well, and
Right.
people can be very skeptical about things, but it's like
Mhm.
it's been around for
Yeah.
20 years now.
Yeah, it has. And I can even say I've been practicing now for about 13 years. And I can say, even just within the time frame that I've been practicing, I've seen us go from a time where almost everybody had HPV on their pap smear to where you're not quite seeing it as much because of the vaccination. And we're definitely not having to do as many of the invasive type procedures that we were doing, even in training at that time, before the vaccine has become more readily available. So it is making a difference in terms of that. Yeah.
Yeah.
Now, so being a cancer survivor, and you have some beautiful pictures that you recently took about your survivorship. And so, what has being a cancer survivor just taught you about life in general, would you say?
It's really made me prioritize myself more. Like I said, as physicians, we struggle with boundaries.
For sure.
It's really taught me better boundaries as far as just better work-life balance of a lot of that work will be here the next day, just trying to enjoy life. So just trying to balance work, but also just I take a lot more. I don't know. I just feel like I'm more intentional. I feel like before I was diagnosed, I was doing a lot of like run trips and just hanging out with people all the time. But after that, I really started spending a lot more time with my husband, just the two of us, making sure that I invest a lot of time there, because when everything came down to it, he was the person who was there. It was just kind of a refocus, because before that, he actually was in residency longer than me. And so I didn't see him a whole lot. So I think that was why I was a little bit surprised. Here now, I was like, oh, you're actually here and you're present and that sort of thing, because it was just different. It's different when you're married to somebody in training. And so just trying to keep that connection to making sure that we keep that strong. And then I don't know, I feel like I definitely have my moments when it is more like like YOLO times. Like I try not to be like too much over there, because I am somewhat of a safe, anxious person.
Yeah.
But I try to like, go out and live a little bit more, live a little harder than I probably would, and just be a little bit more unapologetic about it as
Yeah.
well. Like, this is me, this is who I am. I'm not gonna hold my tongue as much. I think part of that is getting older too. Like once you get over 35, I feel like a lot of times you don't hold your tongue anyway. But this is like I'm gonna go and speak, and I'm gonna write books. And so I wrote my first book after that, working on my next book. I'm like, I want to have a book club. I'm gonna do that. So I think it's just made me just more like experimental to like, you only live once. If I want to have a book club, I'm gonna do it. If I want to write a book, I'm gonna do it, and just not really have as much fear about like, what if nobody buys it, and what if nobody comes,
Right.
and what if nobody reads it. So it definitely helped me just put that in perspective of do it anyway.
Yeah, yeah. I love that. And so that audience, take a note, do it anyway. Whatever that thing is that you've been thinking about, and that's on your heart, do it. Go for it.
Yeah.
Yeah. Now, what message would you like to share with other women who may be at risk for cervical cancer or who may have been affected by cervical cancer?
Yeah. So the biggest thing that I see just like I said, people don't always prioritize their health. So it's important to just make sure you go for annual checkups every year, because I actually have a family culture where we go for health checks every year. And so that culture saved my life, because I was just used to going to see a doctor every year, and then one year was abnormal, and then I caught it early, pretty much at stage 0, and was able to kind of nip it in the bud really early. So my biggest thing was just making sure that people get their annual checkups. And the thing that I know as a family doctor is that people love checking things off their to-do list. Like, oh, I went and had my checkup, had my pap smear. But the follow through, you have to make sure that you do the follow through too. So you have to make sure you check and make sure it's normal, just in case they couldn't get a hold of you and that sort of thing. So make sure you know the results of, your mammograms, your pap smears, any kind of testing that you have for routine screening. And the other piece, because I sometimes write like about health disparities, and one of the things that they talk about is how there can be a delay in care. So I literally went and saw the surgeon within 2 weeks. I handled everything within a month. And some of that I know that is somewhat a privilege of being a physician who has health
Right.
insurance and has enough money to take off,
Yeah.
has like sick time, all that sort of things. I know that piece, there's a lot of privilege and it was not as hard. But I know that there's a lot of people who don't have all those privileges, but you still got to do it, because I feel like a lot of people will talk themselves out of things like, oh, well, they gave me these bad results. But, like grief is hard, a lot of times. But I just always encourage people not to stay in that denial place, because what happens to a lot of people is they're just in denial. They're like, oh, they told me this and I can't believe that. I'm going to go and get 5 opinions. And it's just like, you can get a second opinion, but if the second opinion is the same, then I would just listen to that advice. Don't just keep going around trying to find people who tell you what you want to
Yeah.
hear.
Yeah.
And so it can be hard for people to really get to that place of reality, but just understanding that people are there trying to save your life, and you can keep trying to find people who are going to tell you whatever. But if there's 2 people, you got 2 opinions, and both of them are like, in order for your life to continue, like, with some semblance of survivorship, this is what we have to do. So I think that just trying to figure out how to move from that place of denial to a place of it's going to be okay, and we'll work through it. And life, I say, is one crazy adventure, and you just never know what's going to happen, but you try to figure out how to be flexible and, like a roller coaster, like
Yeah.
how
Yeah.
to survive and not fall off the ride. If you fall off the ride, you hope that you make it and get back up. But it's just one of those things. I think that people often are just like, no, this cannot be, this can't be the news. And I just have found that so many times to not be a helpful place to stay in.
Right, right. Yeah, for sure. And now I know you are a runner and are gearing up for a big race soon, but how has running, I know running can be a form of therapy for a lot of us, even for myself. Was that a part, would you say, of your therapy? Or if not, were there any other alternative things that you did as a part of your healing?
Right. So that's what I write about. That's really what my business has been for me, because I actually got diagnosed the same time that I started my business. So it's been a way for me to cope with this journey. And early on, like when I started Dr. Shomo Knows, I would talk a lot about what I was going through. And it was kind of like a little bit of a journal, like a video journal kind of thing, because I was really just trying to like lean into vulnerability. So I coped in that way early on. But then the pandemic happened and I was just like, all right, I don't want to talk about nothing, no health no more, you know?
Yeah, right. We had enough. No.
So then, during the pandemic, I was coping, like, I was doing, well, Dr. Shomo knows I was doing yoga on Sundays. That was when I was finishing up writing my book. So, but yeah, so exercise has been like a main way for me to cope. But I've actually been kind of leaning more into like restful coping, like writing, listening to books, taking baths, sleep,
Yeah.
and meditation. I've been, learning more about, so like, I would say the hardest year that I had in my cancer journey, it was like a year when I was going to auto fertility specialist trying to figure out, should I have my hysterectomy? Should I not? Like, what should I do? So I went to like 2 different fertility doctors. I was going to acupuncture. I went to like 30 different acupuncture treatments, trying to see what was going on, see if that could be helpful. And then the craziest thing happened with one of my friends dying. One of my friends, like I'm literally like trying to figure out what's going on in my life. And one of my friends just dropped dead.
Mm.
And around the same time, my father-in-law was diagnosed with lung cancer. And it was just a really, I call it the pile on. It was like a year of just things being piled on. And I was just kind of in that stuck place. I call it like, I have a family history of substance abuse, and I was drinking. I was doing a lot of binge drinking on the weekends, I say. And I did that for about a month because I know that you're not like, as family doctors, we talk to people about binge drinking, but
Right.
I just wanted to feel numb. I wanted to feel numb in that time. So I remember just being like, all right, I know I'm not supposed to be doing this. I know it's not a good way to cope. Destructive coping, I'll call it,
Yeah.
So I was just like, I got to figure out some more constructive ways to cope. And so I was planning to go to therapy. And then like I got an email from somebody in our department that they were going to teach a meditation course. And they wanted like some guinea pigs, basically. They offered the course to us for free. And it ended up being like a support group because it was a bunch of healthcare professionals. And we were all just talking about how frustrated and burned out we all were with medicine. And it was before the pandemic. So we were talking about how we were just, how it's just hard. A lot of this stuff just doesn't function like it's supposed to.
Right.
We all had stuff going on in our lives too. So, I was dealing with what I was dealing with, and a lot of other people were dealing with a whole bunch of other stuff. And so it actually really ended up being really therapeutic for me. So I tell people often to consider going to grief support groups because it could just be helpful to just learn from other people, like how they're getting through it, because it's hard. Grief is very hard. And then the pandemic happened after that. And I actually did pretty well with the pandemic because it was kind of like I had boosted my coping skills,
Right.
and was able to cope pretty well with the pandemic. And like I said, I just wrote books, did some yoga, I quit my job,
You really got free. Yeah.
So yeah, I am, I've been trying to lean more into the restful coping. So
Yeah. And that's so important too. Sometimes we live this life of overwhelm, of burnout because we're going. And even with you touching on the fact of going to all of these places to figure out your fertility and all of these other things, but then sometimes just sitting still and sitting in peace with that, taking a nap, journaling, reading a book, doing a quiet meditation time can even clear your mind and recenter those thoughts and be a healing process of its own. So yeah, I definitely agree and excited that you found that as healing for you too.
yeah. So I like to have some balance. I still run. I've been doing boxing lately, so I've been enjoying that. Because it's not. I mean, for me, it just depends on the mood. If I'm in I'm training for a race, so I just have a schedule now. But it's nice. I feel like my job is frustrating. Being a physician is a frustrating job. I feel like especially being a family doctor. I'm like, it feels like being a mom. Like all day long, your kids are all day like, I need this and I need that and I need this.
Yep. You do. You are needed. It's one of those things. You really are. You're needed all day until you want to get home and it's like just somebody don't need me for now. For this time
period. I like running and for me it's like it wouldn't be as bad if we have more help. So the
Yeah.
frustration of like basically trying to change medicine as we're doing medicine and being like,
Right.
what will make this like, it's like being a mom with nobody's helping you. Like,
Yeah.
what
Yeah.
will
The
be
system.
make this
Mhm.
more sustainable is if I had them help. So for me, running helps like with those frustrating feelings, and the boxing helps with those frustrated feelings. And then, like if I have so like now I've leaned more into like if I feel sad, I watch a lot of like comedy on Netflix, or we have like HBO Max and Amazon, so I watch a lot of different streaming to do comedy shows. So if I'm like in a
Yeah.
sad mood, then I'll like watch some kind of comedy special. So I just have like different ways that I like different music, like different albums I listen to depending on the mood,
Right.
So
Yeah.
I've just been like, building up my coping skills the past
Yeah. But
few
what I
years.
like about that is like you've developed a toolbox, if you
Yeah.
will. And so, when those moments come, you can pull from your toolbox, whether it be music or taking a bath or going for a run or doing a meditation or what have you. But you've got this toolbox of things that that are going to help you to feel better. And I think that's the important takeaway is that folks, we do need these skills that we can tap into when needed. Yeah.
Yeah, I actually created a course about it. It's called 14-Day Coping Skills.
Awesome. Awesome. All right.
I
All
have a
right.
calendar.
That's right.
I took it and because like I said, I just learned it. I feel like a lot of us just are not really taught a lot of constructive coping.
Yeah.
And I've learned some of it from my family. I feel like I learned more than most people probably did. But there's a lot of stuff I had to learn on my own. And so I took that and put it into a toolkit, So
Right. That's awesome. Well, good. Well, you beat me to the punch, but I was going to ask you anyway how my audience could connect with you. So they definitely should go pick up your 14-day coping skills package. But what else do you have?
Yeah, so my business that I mostly work on now is Health is Love. Like I said, Dr. Shomo became a little draining in the pandemic. So I kind of like basically, but what I love about Health is Love is that it's more comprehensive of everybody who I am too. It's not really just me doctoring. It's about me doing meditation and me running and all these sort of things that I do. So, you can find me on Instagram at healthislove.co. My website is healthislove.co. I'm on Facebook. So those are the main places where I am. And so I have my book, Health is Love. And that book is actually a guided meditation journaling book to just kind of help people figure out where to work on their health, like how to work on it and where they want to focus, how to take the next step in, working on some piece of their health. And so I have my book, I have my course, and I do events in Cincinnati if people live in Cincinnati. And I'm hoping to, maybe go to more cities as well. So
Yeah. Yeah. Well, maybe we can have you in Chattanooga.
yes, that'd be great.
Awesome. Well, thank you so much, Dr. Shomo, for coming on the podcast and sharing with us today.
No problem. Thank you for having me.
Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.